Hi, everyone. I'm Dr. Sheila Segurson, a veterinarian and veterinary behaviorist who works for Maddie's Fund. I'm going to be talking about a topic that I'm really interested in, and that is the potential role of trauma in animal behavior. When I talk about trauma, I like to start with definitions to make sure we're all on the same page. I'm talking about a psychological and emotional response to an event or an experience that is deeply distressing or disturbing and has long-lasting effects on the being, whether it's a human in this picture or whether it's an animal. Human research tells us that trauma in the first month of our life is most impactful in terms of impact on future behavior. And I think that's really important for us to think about related to animals as well, as it is the same true for animals. And in fact, in humans, adverse experiences of the types listed on the screen, so things like abuse, neglect, and household dysfunction, up to the age of 18, do have these long-lasting effects. And the more adverse childhood experiences, they're called ACEs, that we have, the more likely we are to have negative health outcomes, both behavioral and physical health. You can see a link on the bottom of the screen there that takes you to an article about ACEs, or adverse childhood experiences. I was talking about babies in the first month of life, but really when we're talking about ACEs, it's from the ages 0 to 18. You can take the quiz there and see what your ACE score is. I encourage you to do that. There's many different categories of negative health outcomes that are associated with these ACEs, things like injuries. We're more likely to, if we have more ACEs, we're more likely to experience injuries. We're more likely to have poor mental health, challenges with maternal health, less opportunities in life, more infectious diseases, more chronic diseases, things like heart disease and diabetes are linked to adverse childhood experiences, and we're more likely to engage in risky behaviors. But then what about trauma in animals? Is it the same? Do animals experience the same thing and have the same long-term impacts? The truth is we really don't know, but there is research that supports this concept, and I'm going to tell you about one of these studies. And that is Pierantoni, who in 2011 found that they did a study where they evaluated adult dogs who had been separated from their mothers and their litters at 4 to 6 weeks of age versus 8 weeks of age. So there was a 2 to 4 week difference between when they were separated from mom and litter mate. And that study found that this early age separation was a significant predictor of things like fearfulness on walks, reactivity to noises, toy possessiveness, food possessiveness, even barking, attention-seeking behavior, and destructive behavior. So this study, and there's other studies as well, found a clear link with traumatic experiences in early in life and behavioral problems later on. When we talk about potential sources of trauma in dogs, I think we should be thinking about the same things that we think about in humans, things like prenatal stress. So there are certainly research studies in animals and in people that demonstrate the stress we experience when an animal or a person is pregnant can impact health and behavior later on in life. Stress early on in puppies, early on in development and puppyhood stress, like the puppies in this picture that are living in very, very unsanitary and poor conditions. I think those are things we should be thinking about as potential sources of trauma. Other things like adverse experiences. So that's little Tully on the left, who had been living in a situation of neglect and had been starved, and she had food aggression. When I fostered her, she got adopted out and did great. And thinking about seeing other types of adverse experiences like the shelter experience, or putting them in a drop box, which hopefully most of us don't do nowadays, but as potential sources of trauma for our dogs. And then things like abandonment. We know that in humans, abandonment is a big source of trauma in people. And I think we really need to be thinking about that more with animals, and not judging the people who can't keep these animals, but just thinking about things from the animal's point of view and recognizing that they are losing everything that they know. And then another, the last one to mention is just unpredictable environments, and not knowing what's going to happen and when it's going to happen. We can reduce the impact of trauma on our lives and help people to recover by building resiliency in humans, by creating positive relationships where people feel safe, secure, and supported, where they feel like they can trust, where they feel valued and respected. So this is a slide from human work talking about building resiliency. Can we do the same in dogs? My personal experience fostering and adopting many dogs with trauma histories over the years tells me that in many cases, likely we can help them. But what about when we can't? If you look on the left side of this slide, the right side talks about resilience, which is what we want, recovery from trauma and having a resilient system. But when stress is unpredictable or extreme or prolonged, or oftentimes all of those three, our whole stress system gets sensitized. And it makes it very, very challenging to recover. It makes us very vulnerable to stress. It makes us highly reactive to stressful circumstances. And long-term trauma can lead to things like emotional instability, hypervigilance, increased reactivity, and unpredictable behavior. And so some of these super excitable dogs that we are seeing, that we've done everything we can with them and are having difficulty managing them, are these dogs with, some of them dogs with trauma histories that we need to help them recover from. I think that's certainly something for us to think about and consider. This is a video of one of my foster guys, Funny, who he had a trauma history. He had ringworm as a puppy and experienced social isolation because of that while he was recovering from the ringworm. And he also was adopted into a home where the home was very, very unstable for the first 4 years of his life. Lots of unpredictability, lots of stress. And he was only 15 pounds, but he developed some pretty severe aggression problems. This is a video of him about 2 days into coming to my house. And I'll play it now. I'm gonna have to do sound effects because the sound doesn't work. So we got our first bark box, and I asked him if he wanted it. He's like, yay, and he sits for it. Sniffs it, looks at the other dog coming by, looks at the other dog, still barking. And you can see the other dog's like, oh, heck, I just want to check out the toy. Sorry for my messy floor in the background. But Funny was a dog, and up to that point with my dogs, he had got along with them really, really well. He seemed like he really liked them. So that behavior was very unexpected from him. And you can see how it was very, very sudden. And this dog's trauma history resulted in him behaving in this way, it actually happened towards people he knew a lot more than it did to animals. So what does this mean for shelters, and what does this mean for those of us working in shelters? In my eyes, I would say we need to recognize that our shelters where we're attempting to help animals are often harming them because of the traumatic experience. Some of that trauma we can't avoid. They're being separated from everything that they know. But some of that trauma in terms of being housed in an environment where they have no control over their environment, there's lots of noise, there's lots of unpredictability. Those are things that we really should be thinking about when we're trying to help these animals. What should we be doing something differently, and what should we be doing? And I'm going to talk a little bit about that on the next slide. And because this is kind of a heavy topic, the next slide has some of my foster kittens just for happiness. But I want to talk about puppies and kittens and reducing trauma for puppies and kittens who come into our care. And first and foremost, with puppies and kittens, they are still obviously very early on in life, and therefore we can predict they're probably very susceptible to the impacts of trauma. We want to prevent shelter intake whenever possible. So that might mean asking the people who are bringing them in if they can foster them while the shelter helps to rehome them. It might be looking into whether there's a foster on deck system at the shelter, creating a foster on deck system at your shelter so that those puppies or kittens can be come in, get their vaccines, and then go straight out to foster. So minimizing time in a traumatic environment or preventing it altogether, and really focusing on socialization and appropriate and positive experiences for these young animals. So avoiding traumatic experiences, focusing on the positive. I recommend looking into puppy culture. Puppy culture are socialization recommendations, and you can buy DVDs and books related to this, but a whole process. And I think it's something we need to be thinking about a lot more in our shelter environments, where when we do have these animals coming in, having a very specific plan to what we're going to do to help them, because I feel that some of these puppies turn into some of our challenged adults, right? And is it because of the trauma that they inadvertently experienced as puppies? So really, really working. I'm so interested in prevention and really working on doing everything we can to reduce the amount of trauma that they are experiencing. And that is it. Thank you for listening.